stereotactic radiosurgery to this location. I would say that single fraction radiosurgery in one session is probably the best approach to give a very, very good chance of ablating the tumor and try to keep the side effects under a good control. This area typically does not associate with any discrete symptoms, but assuming that in a situation where very unlikely but very extensive swelling edema, you can have cognitive difficulty and possibly a seizure. So those are sort of more subtle and more global effect that we'll be monitoring. Chance of that happening is small, but certainly something that we need to keep an eye on it.
Okay. Great.
Okay. Do you have any questions for me, or from your discussion with Dr. Tommy or from Debbie?
Okay, let me ask a question. I live in Brazil, and I don't know how. My doctor really recommended Moffitt to me for other reasons because of the melanoma and so forth. Mm-hmm. And we discovered the brain recently, and I had my MRI in Moffitt last week. So my question is, would it be okay to do this radiation in Brazil? What are your thoughts on that?
I don't know so much about the medical care and healthcare system in Brazil. So, but I'm sure that there are centers that will be able to provide this technology, this treatment. I just don't know how to look it up. So
are there any critical questions that I could ask them to be able to compare?
It is very individualized treatment procedure. We talk about the technique and the dose and the treatment program. But that's more in a general form. The actual treatment will need to be carried out and designed by the radiation oncologist, and with the particular facility, the physicists, the machines, and the treatment planning software they have. So it won't be, so just like, surgeons, you can talk about doing this surgery, this approach, but the actual surgery and actual procedure will need to be determined and carried out by the operating surgeons. So I think I'm sure that there are radiosurgery facility in Brazil. I'm sure that there are quite a lot of great radiation oncologists out there. So it's really so you probably have to look up and maybe talk to your doctor and see how you can get access to the system. This is a procedure that we typically do in a very short period of time. I think from the setup to the treatment is typically the most a week, if not shorter than 2 days to a week. So we just need to coordinate everything very well, from the planning, which is the simulation, treatment design, and the treatment planning, MRI, and then contouring and treatment design with the physicist, working with Dr. Tommy, and the treatments typically within a week.
Hello?
And actually, we can do this in a day or 2 or 3 days. So that's doable.
Okay.
So you're saying that probably we can plan the treatment from while we're in Brazil, but from the beginning of the treatment by the recovering part, and he's going to be able to come back to Brazil will be a week, Dr. Yu. Is that correct?
Yeah. I think it's an outpatient treatment, and typically we ask patients to monitor some of the acute symptoms at home. There's no reason that you can't fly or travel right after. You want to take a day or two just to to rest and to recuperate locally, that's fine. That's definitely is a good idea. But most of the patient will come in for the treatment, takes probably about an hour or two. It's complete outpatient procedure, and they'll go home afterwards. So it's a relatively straightforward do. I think the once we design the treatment, which is the most sort of the complicated part, then delivering a treatment is typically pretty pretty straightforward at that point.
Okay, perfect. Thank you so much.
Yep.
Okay.
Mm-hmm.
I think that's clear. Thank you very much.
Yeah, no problem.
Okay.
And so think about it. Definitely, if you want to look for some information in Brazil, I think I think I would recommend going to either a large hospital or an academic center, which more likely you'll have a specialized team to do this procedure. So I would recommend that. And then if you decide, to get this done at Moffitt, or want to arrange a trip back here, we'll be more than happy to try to coordinate that. Okay.
But just one more question, Dr. Yu. I understand that in this case it should be done fast, right? We can't take too long to decide for the radiation and do that, right? Even if it's in Brazil or in Moffitt, it should be done fast, right?
I would say, in the next few weeks,
okay.
will be fine. Yes, we know that there's tumor. We know that the tumor may be, may grow, continuously, but it is not, a situation that you have to say that I need to get this done next week. Okay. Okay. All right. So, so it's certainly, we certainly have time to coordinate and to make all the arrangements. And I will say that you never know how fast the tumor may grow, but in majority of the patients, the tumor follows certain gradual expansion. So we're still going to be able to treat this very successfully within a few weeks.
Okay, perfect. Thank you so much.
Okay, thank you very much.
Now, you can always send a message through patient portal and then reach out to us, one way or another, okay?
Okay.
Okay, perfect.
Okay. Thank you.
Take care.
Take care. Bye-bye.
Nice meeting you.
Nice meeting you.
Bye.
Meeting you both. Thank you. Bye-bye.
Bye.